I'd like to now introduce Dr. Scott Lear. He's a professor of Pfizer and Heart Stroke Foundation, chair in cardiovascular prevention research, and a professor at Simon Fraser University. Dr. Lear recently experienced personal mental health issues, and he will share the toll and barriers of the disease. So his topic is the toll of mental illness. Over to you, Dr. Lear.
All right, thank you so much for that great introduction, and thanks so much for inviting me and allowing me to share this. It's definitely something outside of my traditional presentations on cardiovascular health. And so I'm hoping that it will go over well. Let me start my slides. Okay. So mental illness is all around us, and it's estimated each year 1 in 5 Canadians will have a mental illness, so 20%. And that's an incident rate that's much higher than diabetes, prevalence rate higher than cancers. So it's extremely, it's an extreme burden on society. It also goes well beyond those who are afflicted, because most commonly mental illness in one person can actually challenge family relationships with friends, and at work. Now, that can be said for a number of other conditions, but in my experience and what I've learned interacting with people with mental illness, I don't know any other type of condition that's as destructive, has the potentially destructive nature within family relationships. Now, it also is not a condition of older people. 50% of population in Canada will have a mental illness by the age of 40. And most of mental illness can be derived, or in some cases have onset or factors relating to childhood. Now, in December, I was diagnosed with depression, and I put this up because I wrote this in my blog about my journey and some of the issues I came across with treatment. But I realized looking back that, and my story is probably not different to many others, and looking back, and I was probably experiencing a decline in mental well-being for years before that diagnosis, before the pandemic. I'd like to blame it on the pandemic, but I wouldn't say that was the case. I know that the challenges of the pandemic have had kind of exacerbated and made it come to the forefront. But at the time, I was telling myself it was okay to not be okay, basically on a daily basis. And I was also thinking it's just affecting me. And it actually wasn't until my daughter and my wife kind of called me out on behaviors at home and being irritable, just non-responsive, that I actually started to realize I need to seek some help. Now, the pandemic has exacerbated mental illness, has led to people having poor mental health. And this is actually a slide that came out early in the pandemic, predicting, and so far a lot of the predictions are coming true, 4 different waves. The waves of immediately due to infections of COVID, the impact on restricting resources for non-urgent conditions, so shutting down of outpatients, delaying surgeries, and then interrupted care on chronic conditions. So I work in the Healthy Heart program. It's a cardiac rehab program at St. Paul's Hospital. And for a good 2 years plus, that program was shut down. Yeah, there was virtual supplementation, but I also know plenty of programs that shut down and didn't have any virtual supplementation. But this is the fourth wave is what is really concerning, and it's the effect, and it's probably going to be the longest lasting wave, and it's the impact on mental health. And yet, as I mentioned, as with me, it exacerbated my condition. For others, it's going to be problematic because a lot of what we might see as our day-to-day social supports, things that bring us joy and happiness in life, things that help us reset, were absent. We weren't able to socialize with friends as much, see people face to face, definitely. Travel was restricted. If you were part of going to a community center, much of those were closed down. So not just necessarily the stress, which is big on people who might have had financial challenges, lost wages, but also in the fact that not able to access those supports that one would normally do on a daily or weekly basis that can help reduce the stress and bring reset, get us grounded. Now, the numbers that we see on mental health, I suspect that they're underestimates, because just like for me, I basically would have delayed treatment probably for 4 years or so. But stigma is another reason why people don't even seek treatment. And some of that stigma comes from our healthcare industry as well, because we spend a lot of resources and design our hospitals for organ-based care, but there's very limited care for mental illness in hospitals, treatment facilities, and so forth. And we actually, if somebody calls 911 to get support with either themselves or somebody else who's experiencing a mental illness and maybe having an acute situation, it's the police that respond. The dispatcher sends the police, not the paramedics. That would be like sending a cardiologist out to a robbery. The police are not trained in this, and it sets an expectation that people with mental illness are inherently violent. But in fact, that type of confrontation leads to violence. And for that it's a huge reason why when I've talked to people that I've met through my experience, they're not calling 911 because they don't want to end up thrown on the floor in handcuffs and put in the back of a car, which has happened to some of them. Here's some of the things that I've come across or other people have come across in terms of stigma. It's all in your head, just get over it. They're crazy, can't handle stress, suck it up. I had to go see a counselor a number of times, but not in like a very kind of compassionate way, as if like if you go see a counselor, it's just like going to get a mole removed on your skin. Once you see the counselor, everything's going to be fine. Stop feeling sorry for yourself. Another one, there are people far worse off than you, which, yeah, that may be the case in some objective measure, but it doesn't lessen the pain that people are in at that time. And it doesn't actually help people knowing that there are others worse off. It doesn't make you happy knowing that people have it worse off than you. Now, touching on some of the topics related to the theme of this conference. So women experience anxiety and depression and mood disorders more common than men. And there are specific risk factors for women in society. There's gender discrimination, pressure from multiple domestic roles. So that could be caring for kids, caring for a spouse, at the same time working, caring, doing domestic role chores, and maybe in some cases caring for older parents. There's gender-based abuse and violence, and things like pay inequity, lower standing in society, makes things that may be jobs that may be, you know, providing some happiness, less happy knowing that your male colleagues are getting paid. more than you for doing the same, if not actually worse work than you're doing as a woman. And bringing that also into the South Asian community, again, we see higher rates of poor mental health. And some specific factors include racial discrimination, greater financial insecurity due to lower wages, challenges in certifying expertise from out of country in Canada. So if there's somebody's being licensed for a profession coming to Canada, it's a challenge to get that certification. Acculturation challenges, and some of our research has touched on this. And then there's this push and pull between what we might say the mainstream part of Canadian society is individualistic versus a collectivist culture, and trying to fit, feeling the pressure of an individualistic society, but also that collectivist culture of family. Personal fulfillment versus family expectations. Now this can transcend South Asians for sure. It's not unique. Lots of different cultures have that. There's definitely a lack of culturally relevant therapy, and there's definitely a lack of therapy in general. And when I was looking for therapy, yes, my family physician was very, very good, and she prescribed medications. But the other aspect, like getting behavioral treatment and behavioral therapy, robust behavioral therapy, isn't really provided in our healthcare system. There are different NGO organ groups that put together workshops, programs, and some of the health authorities do, but it's not the robust type of treatment that we might need. The ability to access inpatient residential care is quite limited. The one that I looked into, you had to be basically extremely severe to get in. And then it's a case where you might stay there 5 to 10 days. And as one patient called it, it's basically treating and streeting. And it's not providing any long-term substantial care. Waits to see psychiatrists can be up to 2 years. And many psychiatrists won't see a patient until they're already on antidepressant. So for me, I feel privileged enough that I have a job that could allow me to take medical leave. I had the funding, and I paid for private treatment. And I was in a residential program for 7 weeks, and that was at a cost of close to $50,000. So that is obviously not obtainable for many people. There are employers that had sent people to the same program, but again, even if you find that lack of culturally relevant therapy that can understand and appreciate these specific challenges of people in the South Asian community. Other things, mental well-being, not openly discussed. Like pretty much almost every culture has this. There are different levels. My dad, when I was talking to him, he's like, saying good for you for speaking up and seeking help. He said, when I was growing up in England, it was always keep a stiff upper lip, keep calm and carry on. And then there's concerns of shame. And pretty much everybody I've talked to, and myself included, experience shame, like both individually and shame to family. What's this going to mean to my family and people around me? In terms of the pandemic, and this is from early on in the pandemic, this survey from early May 2020. So that's only about maybe 8 weeks after it was declared a pandemic in Canada. And that non-white minorities experienced poor mental health as a result of the pandemic, but more so of the groups, it tended to be the greatest mental health challenges were in people who identified as being of South Asian origin. And this could be due to a number of things. Like we heard, like both in very large South Asian communities like Brampton area in Ontario and Surrey area, there were a huge burden of COVID cases disproportionately affecting those communities, in part because there are a lot of front-facing jobs or places in Brampton. There's a lot of warehouse distribution, and it wasn't able to physically distance. And it was also a case where many people in the community had jobs that if they didn't physically attend, they couldn't actually get paid and do their job. Whereas, you know, I've been sitting at home for the last 2.5 years getting paid. So I'm going to end here with various different resources because people might find that helpful. There's the 811 line where you can speak to a nurse. 211 line is like a social resource. It will direct people to mental health resources, but it will also, there's a lot of things that are coincident with mental illness, like housing challenges, employment challenges. What do you tell and what do you put on your resume when you've been out of work for a year because you've had mental health issues? You know, if you put down that you had cancer and being treated for it, it's probably going to be read differently with maybe some sympathy than somebody who puts, I had to leave work and I had to undergo treatment for my mental illness. Like a lot of employers would probably pass on that individual. Some online resources, family physician, and if you're fortunate, people who they might get extended benefits through employment family assistance program to see a counselor. There might also be in those benefits a certain dollar amount to access psychologists. And when things are quite acute, here are some crises lines that you can talk to somebody right away. And I've phoned on at least one occasion and found them to be quite helpful in the acute moment. Right, so thank you for your attention. I'm happy to take questions. And if you want to look up my blog where I wrote about my own situation, it's drscottlear.com, and I also talk about some of these things on Twitter and Instagram. All right, thank you.
Thank you so much, Scott, for that great presentation and for the exposing your vulnerabilities. Of course, we've been working with you since day one of CINS back in 2010. As people know me, I'm a great advocate for the patient experience. And I think in your case, you're blending that patient experience, and I use patient generically, experience with also your research capacity and your research background. You know, what I'm hearing from you, which I don't think is a surprise, is that there are great gaps in our system when it comes to mental health, and there's a great deal of work that needs to be done there. But I think it's people like yourself that's reaching out and having these conversations is what's going to help to move us forward. I'm just going to look at very quickly. We are at time, but I'm just going to see if there's a question I can pull out of here from a theme. Some people are putting some resources on there, so thank you for that. Lots of thanks, Scott, for sharing your story. Yes, yeah, and thank you for sharing those resources as well.
Minnie, this
yes.
is Arun here. If I could just share that Canada-India Network Society is currently working with a group called Stigma Free Society. This is an NGO in British Columbia which developing tools for youth and schools, and they have asked us to help them in bringing South Asian lens to those that work. So we're quite excited working with them and other members, and especially our community. This is a very big topic for us, and we are actively pursuing it as one of, and we'll be making some recommendations. And I really appreciate for Scott to go from original topic was supposed to be COVID and few things, but then he really took this challenge and fantastic. Thank you, Scott.
Thanks, Arun. There was one question, Minnie. I saw that Joanne Curry had about particular age groups seriously impacted by mental health. Yeah, what I understand in terms of suicide, it's the age group that has the highest risk of suicide are middle-aged men, followed then by youth, young adults, and teens. And so I was actually surprised about that, for middle-aged men being the highest proportion of suicides in the age group. And in terms of resources, there tends to be, I've seen some better like residential programs for teens that are not as nearly as expensive. They have some subsidized funding from health authorities. The wait lists are long. And so there's one in the Vancouver area called Looking Glass, and I think that targets teens with eating disorders. But that has, it's a great program, but it's like a 6 to 8 month waiting list. Whereas a lot of the private ones, that's another thing, the wait list is about 1 to 2 weeks for those. And some of it is also just a case of finding things out. And it's great that people have put down all this different information in the chat, because, you know, when I was looking, you know, I was just Googling mental health treatment programs, and that's how I was trying to find some help for me.
Yeah, thank you so much. We were a little over time, so I'm going to hand it back to Nita to take us to the next talk. Thank you so much. Thank you so much, Scott.